You all know that aging is a constant process, and with aging you can actually lose your connective tissue which is underneath the skin. The collagen, the elastic fibers which contribute to the tension in the tissues is actually lost. And also with aging you have a depletion of fat which is contributing to the various fat pads. So when there is actually a loss of volume in the cheeks or under the skin, you tend to have a little bit of sagging, and with aging these folds keep on getting more and more pronounced, and then you can have a very severe fold. So early part of aging you'll have mild folds, a little more aging, moderate folds, and when the patient is really in their 60s and 70s you can have a severe fold, especially you can have a severe laugh line, you can have a jowl line which is actually sagging, a very sagging neck. So there are folds all over the face which need to be lifted. So that is why we do what's called as a facelift. Now facelifts are two types: the surgical facelifts and the non-surgical facelifts. So when we talk about the non-surgical facelifts, these are usually used for mild to moderate folds. So we talk about threads which actually are passed under the skin, and because of the nature of the threads, they have barbs inside them. These help in actually lifting the various tissues up, and this help in maintaining the raised tissues because of the barbs. And these usually last for around 1.5 to 2 years. So they are temporary and they're not permanent. And but these are not surgical. They don't require any major surgery. It can be done as an office-based procedure. Often takes maybe 30 to 40 minutes of time, and quite often the patients are happy with the minimal correction, and only done for mild to moderate folds. Okay. Now when we talk about severe aging signs, especially on the face and the neck, the only option which we have is a surgical facelift or a neck lift. Now what happens in a surgical facelift? The incision is made just in front of the ear, a very concealing incision, and goes around the ear lobule, goes behind the ear, and goes onto the scalp this way. And there can also be an extended facelift where you actually extend the incision so you can get even an upper facelift over here. So you have a standard facelift which has the incision going all the way like this, and these days most surgeons will also use a short scar facelift, which is nothing but they just use an incision over here, just over here, going across the sideburn like this and stopping here. So with this you'll be able to actually do a lot of work over here in terms of getting your nasolabial fold lifted, in terms of getting your jawline also treated. So this is a very good procedure for that. Also there are more extensive procedures like the deep plane facelift, depending on what the patient wants to address. The deep plane facelift is also done to address various deformities of the cheek. So you have these are the standard facelifts. When it comes to the neck, also you can treat the jowls as well as the submandibular folds over here near the jawline. And this is also done by giving an incision over here, which is again a very concealing incision over here. Through this, the neck is lifted, and sometimes patients may also require an incision over here to address the platysma which may be sagging and hanging. So often surgeons might have to use this incision, but sometimes the surgeons may also use this incision to manage the folds of the neck. So a combined facelift and neck lift is also possible with these surgeries for very extensive folds on the cheeks as well as the neck. Preparation for a facelift: generally patients coming to us for a facelift are in the older age group, maybe beyond 55. So I ask my patients whether they are taking any antihypertensive medications, whether they are on any medications which are thinning up their bloods, because most of these patients sometimes they have a tendency to have strokes, so their neurologist must have started them on some blood thinners. So we make an inquiry about whether blood thinners have been given by their cardiologists or their neurophysicians. Now if the patient is taking any blood thinners, generally the blood thinners in consultation with their physicians We stop for a week and then we go ahead with the surgery. The other things are routine like basic surgeries. We ask them to see our anesthetist, and if they're found fit, they can go for the surgery. The post-care instructions after a facelift is very simple. They'll have to be rested for maybe 3 to 4 days, and usually they'll have to apply ointments on their suture lines. There's no heavy bandaging. I don't bandage my patients even for neck lift. No straps are given. It is just ointments which are applied on a daily basis, twice daily, and that's the care they'll have to take. There might be drains inserted into their under the skin, so these drains might probably have to be removed after 2 to 4 days, depending on the quality of the exudate which is actually coming out. So once the drainage is less, we remove the drains in 2 to 4 days. And massages is usually started after a week of time, where all the swelling is actually netted out, so that the patients lose their swellings, they get back to their routines and their work by the end of 2 weeks. The results after a facelift is almost instant. On the table we notice all the changes, but however, because of the swelling which is getting into the tissues, the results are masked, and usually on the first day, second day, you'll not be able to see much of the results. That's because of the enormous amount of fluid which is being formed in the operative site. So we usually tell our patients by the end of a month or 6 weeks, you'll be able to see the results which we've actually given you on the operating table. The results of a facelift generally last for almost up to 7 to 10 years. You might not have to do anything in between. I mean, this is the advantage of undergoing a surgical facelift, contrary to the non-surgical facelifts where something or the other has to be done because it is temporary, and you'll have to again go for a separate lift procedure or a thread lift, and might have to go for fillers. So all this can be avoided in a facelift, where a single shot surgery will normally last you for good 7 to 10 years. So to conclude, facelift is a pretty safe surgery. It's very routinely done. The maintenance is also not much. By 7 to 10 days, the healing takes place, and generally the results are seen after 6 weeks of time. The results last for almost 7 to 10 years and have a beautiful result maintained for a long time.